To insert a nasogastric tube in the patient has to be on the high Fowler's position. And you have to spray a topical anesthetic in the nostril at the pharynx at least 5 minutes before tube insertion. You have to estimate the proper distance of insertion. You have to measure to the nose to the earlobe or the angle of the mandible. After that, you have to mark it. After marking it, you have to measure the distance between the earlobe and the processus xiphoideus. After measuring it, you have to mark it. And you add 6 inches. This will correspond the distance of the tube. You also have to coat the tip of the tube with a water-soluble lube. Ask the patient to take sips of water through a straw and advance the tube during the swallows. It will facilitate the passage through the esophagus. Remember to gently insert the tip of the tube into the nose and slide along the floor of the nasal cavity. Aim back, then down to stay below the nasal turbinate. If the patient is unable to speak, has a hoarse voice, or is gagging, or is in respiratory distress, the tube is probably in the trachea and should be removed immediately. After inserting the tube in the patient, secure it with a tape attached to the wide half part of the patient's nose. Apply benzoin to the skin if available. And aspirate the stomach content to test the pH